FDA approved and prescribed drugs that are in the GLP1 class.
Yep.
They also seem to increase growth hormone. And the strongest link between those, even though the data is mixed, is between the GLP1s and thyroid cancer. And that goes back to the preclinical model.
Now, growth hormone seems like a huge risk factor for thyroid cancer, both here when you look at the data and also anecdotally.
Yeah, it's something that we wondered aloud about when we're thinking about the most popular weight loss agents now. They are actually growth hormone releasing peptides, and not talking about research chemicals, talking about FDA approved and prescribed drugs that are in the GLP1 class.
Yep.
They also seem to increase growth hormone. And the strongest link between those, even though the data is mixed, is between the GLP1s and thyroid cancer. And that goes back to the preclinical model. And I think there's even one meta-analysis on either side of that, where it seemed to be neutral, a wash, and then one seemed to be a link. And people that have a financial interest in prescribing these will say that there's no risk there. But I don't think it's safe to say that just yet. And I hope that I'm wrong. But I think that there could be a concern. You're definitely losing weight. You're going to lower your risk of all these cancers, cancer globally. But depending on the age, you may slightly increase your risk if you're using a GLP-1 for the thyroid cancer specifically.
Yeah. As people know, GLP-1s, one of our favorite medications, one of our favorite peptides. When I talked about this in the Protein Bros podcast, there were a lot of people who were upset. They're like, semaglutide, entirzepatide are amazing and they can't do anything wrong. And they definitely don't raise any cancer risk unless you have multiple endocrine neoplasia. And we don't really know that, especially in the case where you're blasting and cruising your GLP-1. Because, if you sign up for the Weight Watchers or Slim for Life or whatever your cookie cutter or just your med spa, you go to your med spa and you sign up for their GLP-1 program, you get your poor quality compounded semaglutide and you blast it for 6 months and then cruise and rebound and yo-yo all your weight back. So it's like you're sparking the inflammatory cascade when you're obese and causing cancer. So you're giving your body every chance to start that cancer and then you're growing it as you're on the semaglutide. So if you lose the weight and you permanently keep it off, then in that scenario, I could make a case that, your overall cancer risk is going to be much lower. But if you're just going to be yo-yoing every single time, that is likely synergistically higher cancer risk if you think about it mechanistically.
Yeah. And that kind of ties in with something that we've spoken about. And I think I heard you talk about probably 2-3 years ago at this point is, the metabolic damage of these weight loss and gain cycles that happen over and over and over again, where people get proportionately fatter each time because they're losing lean body mass. And then their metabolic rate is going to just keep dropping and dropping and dropping. You're digging yourself into a deeper hole.
Why is it unhealthy for bodybuilders to do GH and then bulk and cut? You see a ton of rates of cancer. I mean, we mentioned before, I believe Dallas McCarver,
20-something years old,
had a thyroid carcinoma. And we've seen a much higher cancer incidence in bodybuilders and also just individuals utilizing exogenous growth hormone.
Or exogenous insulin. Type 1 diabetics, I think within the past year, there was a study there. If you break them down by their insulin dose, those that were taking more insulin, this was normalized to body weight, those people had higher rates of cancer.
It's just frustrating to see 20 or 30 years ago, after the New England Journal of Medicine study on HGH, and, it was a miracle drug, body composition, less fat, more muscle, better sleep, better aesthetics. And then all of a sudden we realized, we really shouldn't be doing this because we're growing all of our tumors and causing metabolic syndrome, HGH-induced
insulin resistance,
and even diabetes, similar to essentially the same as gestational diabetes, which is caused by human placental lactogen, molecule from the placenta, very similar to growth hormone. But now we're kind of repeating that cycle because HGH is not cool and bodybuilders should be shamed for using it. But everybody should take a GHRP peptide like tesamorelin or CJC, which we've also talked about, or GLP-1.
Yeah, and I think part of the problem there is it's just there's no large-scale studies of these things. In some cases, there are fairly decent-sized studies. But those are for specific medical conditions where the benefit definitely outweighs the risk for most people,
Yep.
as opposed to a average person of the population who is metabolically unhealthy, who is taking these because they heard that everyone needs to be on peptides and they're the new latest and greatest thing.
Yeah, I'm just taking it to be a little bit more shredded.